I'm Katie Schubert, and I'm President and CEO of the Society for Women's Health Research. SWHR was founded in 1990 by Dr. Florence Hazeltine and a group of physicians and researchers who saw the need for better information on women, as well as those who are historically underserved in research. SWHR is the thought leader in promoting biological sex differences in disease and improving women's health through science, policy, and education. Women's health is inherently a health equity issue. Disparities exist not just between men and women's health outcomes, as conditions might present differently or disproportionately or exclusively impact women, but disparities exist amongst populations of women, and these disparities present in a number of ways: age, race, ethnicity, geographic location, and even as the role of caregiver are all important pieces of the health equity lens. The Women's Health Equity Initiative aims to share the stories of women and their health journey to better understand women's health disparities and the intersectional ways in which they exist. These stories illustrate what the data is showing us about inequities in women's health. For over 30 years, SWHR has led the national conversation on women's health by identifying gaps in research, knowledge, and burden of disease and conditions. We continue to be the national voice for women's health through our Women's Health Equity Initiative. SWHR hopes that the Women's Health Equity Initiative empowers women to share their stories, learn more about their health, and affect systemic change in healthcare for all women. We envision this initiative as a unique opportunity to fulfill our vision to make women's health mainstream and to engage the community in ways in which we can reduce health disparities and improve women's health inequities across the United States. Take a look around and learn more about the women sharing their stories. We're bringing together women as patients, as caregivers, and also as clinicians and researchers. Not only can you view other women's stories, but I encourage you to share your own story with us through our Stories portal. We encourage our partners, other organizations, and industry to support the Women's Health Equity Initiative by underwriting health equity sponsorships as we continue to amplify these essential voices and information. We also invite aligned organizations to share your own links and resources with us so that we can support your work as it relates to women's health equity across the board.